This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for joining this week's NC Spin. There's a lot to talk about this week, including a disturbing downward trend in fighting COVID-19. We talk about that, plus orders to close the Speedway. We look at several proposals in response to racial violence and ask how things might change. And we look at new guidelines for sending our kids back to school and want to know if they can be safe. Plus, the panel will tell us something we don't know. Joining our panel this week are Chris Fitzsimon, Director of the state's Newsroom, Beavon Gravely, Executive Director of NC Free, Howard Lee, former state senator and former member of the chairman of the State Board of Education, and John Hood, syndicated columnist and author. We'll begin our uninterrupted discussions after these brief messages from our underwriters.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
Before we get started, we want to welcome Nick Fuchs back to the producer's chair of our show. We've missed him. Let's begin the spin. On May 22nd, North Carolina entered phase 2 of reopening. And they were telling us it would take about 14 days to see the effects of these small steps. Well, over the last week, we saw them. A surge in the number of cases, increases in the percentage of people testing positive, and a big jump in the number of hospitalizations due to COVID-19. Health and Human Services Secretary Mandy Cohen said our trends were going in the wrong direction, and we needed to continue to work to keep from overwhelming our healthcare system. Beavon, one of the big stories this past week was that the Ace Speedway in Alamance County had a second instance of disobeying executive orders, had 2,000 fans at a race last Saturday night. Governor Cooper said local authorities didn't enforce phase 2, and he declared the Speedway an imminent danger and ordered it closed. The Speedway said they wouldn't comply. The state filed a temporary restraining order. The judge granted it. Your reaction to all of this?
Well, the big takeaway for me is that the people of North Carolina are just tired. They're tired of being told to sit and wait and be patient, sit and wait and be patient as businesses continue to go under and unemployment climbs. And it sort of just feels like we're playing the role of the stereotypical restricted high schooler that the moment they get to college, they go wild with excitement and the freedom that exists. And it turns out that if the governor and his administration continues to tell us to sit and wait and be patient, we're going to see more of this.
Like the fellow said, Lord, give me patience and I want it right now. Howard, the Speedway owner said that Cooper's executive order was unconstitutional. Judge Tom Lambeth Jr. Didn't appear to address that charge, but he did issue the restraining order and say he would take this issue back up June 19th. This could be a pretty important hearing, couldn't it? Isn't it going to focus on the constitutionality of the governor to issue orders?
I think it possibly could. I do think the governor's on solid ground. I think what happened at that Speedway is what I thought should be done across the board anyway, is the governor and his staff set standards, expect people to live up to those standards, and then let them make the decision within that guideline. And if they don't, come down hard on them. And so in the case of the Speedway, this is exactly what happened. And I think the governor's on solid ground, but I certainly think the hearing is going to be an important decision for setting the stage for our future and how governors can behave.
John, the owners of the Speedway said they were being singled out in this particular instance, that other people were conducting races and big events and so forth like that. Um, is this evidence? We're seeing Alamance County with a big spike in the number of cases, the number of hospitalizations required. Is this evidence from the race that they held 2 weeks ago? Is this going to yield big spikes again?
I doubt it because it didn't do it the first time. The spikes do not appear to be related to the racing events in Alamance County. I think that the best argument the racetrack folks have is the selective enforcement argument, that they were targeted. Other racetracks, including the NASCAR race. The NASCAR race did not have a large audience. It still had hundreds of people together in an outdoor venue, which is a apparent violation of the governor's order. And yet it was done in conjunction, in negotiation with the administration. I think that is the vulnerability. Probably not the constitutional argument at this moment, but it's the selective enforcement argument that if anything were to prevail, it would be that one.
Following up on that, Chris, does that mean we're going to see the same kind of orders being issued other speedways and other venues, people disobeying the executive orders?
Well, I guess that's what we're going to see. And I think part of the challenge here, as Anna Beavon said, for example, it's like people going to the university or people going to college and wanting to be free and all that. The only problem is we're dealing with a deadly infectious disease. We have record numbers of hospitalizations for several days in a row. And what's so stunning to me is while that's all going on and we're debating all this, some of the same people who demand that we have no restrictions or demand that we open refuse to wear masks to protect other people, which is the single now most important thing we can do. This disease is spread primarily through personal contact. You protect other people by wearing masks, and we have leaders and advocates who are saying we need to open and business is the most important thing. Well, if we're going to do it, for goodness sakes, why can't we do it safely? I'm still perplexed that we see pictures and images all over the place of people beside each other who think somehow it's not manly to wear a mask to protect your neighbor.
Anna Beavon, this was not the only restraining order that was sought this past week. Several owners of gyms tried to get a restraining order to keep Governor Cooper from refusing to let them open, and the judge would not grant that restraining order. In the meantime, the legislature passed a bill which said that gyms and bars could open. It's sitting on Governor Cooper's desk. They didn't try to override the veto the first time around when Governor Cooper vetoed it. Are they going to override this bill from his veto, or going to attempt to override it?
I think they're definitely going to attempt to override this one. I think the first one was a chance for the governor to play nice with the General Assembly, or the General Assembly to play nice with the governor when it comes to getting more of North Carolina back to work. But I think this is going to be one of those times where the General Assembly is going to make this a reality.
Howard, you sat in that chamber for many years. Can they get the 3/5 vote that they need to override the veto in both houses?
I don't think so, and I'm not sure that it would be a smart thing to do. You can question the system the governor is using and the process of making these decisions, but at the same time, as Chris said, this is a very deadly disease, and I'm just disappointed that many of the influential leaders don't themselves even wear the mask to protect themselves. So when I look at the legislative chamber, I certainly think that there's going to be a close call. If I was sitting there, I would not vote to override. I think it's more important to protect people's health than it is to try and override a veto at this point.
But they had some Democrats' votes in passing this initiation to begin with, didn't they, John?
They did. In fact, I think it would be overridden in the Senate. It's just a question of whether it would be overridden in the House. I think it's at least conceivable that it could be overridden. This revised legislation allows the governor to reenact. This time, I hope, actually, the law would make it clearer that he would have to follow the original statute, which involves Council of State approval. But I think the bottom line here is people have different levels of risk preference. They have different interpretations of the data. The rate of positive tests has been it's bouncing around between 8 and 10% since the reopening in May 22nd. And the evidence of the hospitalizations is actually rather muddy, because we are, in fact, having more people go into the hospitals to have other conditions addressed, have surgeries that were deferred, have other things. And yes, they're all being tested. So what we're interested in is how many people were hospitalized because they had COVID, given the fact that the other metric that the state has been tracking, which is the share of emergency room admissions that have to do with COVID, has not been going up. That suggests that these data are more complicated. They require more careful consideration than, frankly, either side is currently. The politicization of this moment, I think, is mistaken.
Well, it is highly politicized. There's no question about it, Chris. The legislature passed a bill and sent it to the governor's desk that would require hospitals to allow at least one family member to visit people who are hospitalized. The ruling, of course, had been with nursing homes and with other congregate care kinds of facilities. They wouldn't allow people to come in and visit. Is Cooper going to veto this bill?
I'm not sure, but it is. I continue to be surprised that people in the General Assembly believe they know more about hospital admission policy, infection rates, and disease than the people who run hospitals and the public health professionals. And I think, and I say this every week, the elephant in the room here is when's the last time we heard from Dr. Fauci, the CDC, and national messaging? We are literally leaderless in this country. And so we're turning to governors. We're mad at governors. Arizona's hospitalization rate is going through the roof. The virus is moving into the South and the West. The data is pretty clear about that. And yet we're arguing about bars and restaurants, which I appreciate that they're struggling. I hope that they got relief from the loan program. We don't even know the details of who released that. We're living in a vacuumless, a leaderless time, and we're all flailing about while we have an infectious disease on the rise. It's frankly stunning.
And on top of all of that is the controversy surrounding the GOP convention. They announced this week that the convention, the big rally for the convention, would be held in Florida. After the dust has settled a little bit here, we've got 1,000 new cases every day. We've got record numbers of people in hospitals due to COVID-19, according to Secretary Cohen. And so the question is, regarding this GOP convention, who won, Trump or Cooper? I'm going to ask everybody. John?
Well, Cooper got what he wanted. He didn't want the convention, so he got what he got. That I think that in the long run it will hurt him. He's basically saying, rally if I agree with you. That's okay. Rallying thousands of people together. Rally. That's okay. But if I don't agree with you, you can't have a rally. Remember, this large event that's going to be held will probably be outside in Jacksonville, Florida. I think they could have worked that out.
Arena. They're actually talking about doing it inside in an arena.
Even then,
Trump is having a rally in Tulsa Friday night with 19,000 people in an arena. He's asked them to sign something saying if they get
got to sign a waiver.
They have to sign a waiver. That's what Cooper doesn't want in North Carolina is 19,000 people inside a building and then going around to the rest of the state.
They should have worked it out. They should have worked it out to do this big coronation event outside. That's my view.
And the governor's office was negotiating with the RNC, and Trump intervened with a tweet blaming Governor Cooper. Cooper and public health won. That's who won.
All right. So Cooper won. Chris? Howard, who won?
I think we won as North Carolinians because we don't have 19,000 people shoulder to shoulder in an arena in a pandemic.
All right, Howard, Trump or Cooper?
I was going to say that the people of North Carolina won because I've been very nervous about this convention and that number of people being held in an arena. And I think the chances of spreading that disease in this state is getting more and more possible all along. I just disagree with thinking that we can hold a convention and that's more important than protecting people's health. So I'd give it to the people of North Carolina and partially to Cooper.
Anna Beavon, who won?
I think they both are going to claim victory here. There's still discussion of having the business session in Charlotte. So some of these contracts will still hold, but Trump himself will not be here, so he will claim victory over it.
But the Republican National Convention Committee has limited every state to having 6 delegates. So even though they may be honoring the letter of the law on some of these contracts, Charlotte's not going to see such a big economic boost.
No, absolutely not. Absolutely not. They lost in this whole story.
Let's switch gears a little bit. Most everybody in North Carolina agrees North Carolina's 1.6 million K-12 grade school children need to return to class. Now, the big question is how to do it safely. This week we got some guidelines as to how that might happen. The Department of Health and Human Services, the Department of Public Instruction, the State Board of Education have issued what they called Lighting the Way Forward. This plan has 3 phases ranging from minimal social distancing, moderate social distancing, and a return to online instruction. The decision as to which phase is selected will depend on how North Carolina is managing COVID-19. Howard Lee, you were chairman of our State Board of Education, and you continue to work with school children across our state. Secretary Cohen says, while young children can certainly be infected, they don't seem as susceptible as older people. And we want to talk about the specifics of this plan, but I want to hear your reaction to the Light the Way Forward plan.
Well, I love these slogans that people throw out these days, but I think the guidelines are fairly clear and certainly give an indication of what possible directions we can go. I like the thought that they will listen to the governor by July 1 to determine if the conditions are such that they can proceed forward. I do see some real positives in the guidelines and think that kids can be managed safely in the classroom, and I'm delighted that we're moving in that direction. But we've got to be very careful because in spite of that, we still had one child die, and others could contract the disease, and we can have other deaths by pulling them all together.
All right, so the basics of the plan is minimal social distancing, which means essentially kids go back to school the way they were before the pandemic hit. The moderate, or the plan B, is the moderate social distancing, which would require some separations, 6 feet separations and various things like that. And then the third option is we just go back to online learning, which I think is the least palatable for everybody. But Governor Cooper gets to make that decision, and he's supposed to make it by July 1st. That's 2 weeks from now, John. What are we going to know then that we don't know now?
I'm not sure that people will have changed their views one way or the other very much on this. Tom, I think you're being charitable, very charitable, this plan. The plan A is not minimal. I mean, whatever term they want to describe it, has lots of requirements in it. I think it is likely to be impractical, just plan A. Plan B involves probably alternating between days, so students would go to school on Monday and not on Tuesday. I think they will also find that impractical. I understand the motivation. This is, as Howard said, it's a challenging topic, but we're going to have to be very realistic about what is going to happen in a school, sometimes in some parts of the state, already an overcrowded school, with lots of kids coming in who are not known for following, second graders who are not known for following instructions easily. We have to be very clear about what is realistic here. It is also not realistic to have semester at home again. I think you will have a significant rebellion against that.
I think you're right about that. Anna Beavon, you come from a family of educators. There are some people who are suggesting, wait a minute, this should not necessarily be a statewide decision on how we're going to do this. We ought to turn this over to the LEAs, the local education authorities in each county, to let them decide on Plan A, Plan B, Plan C. What do you think of that?
Oh, I definitely think that's the best way to go. Not every part of the state has been impacted the same way by COVID, and giving schools the opportunities to be able to figure out what works best for them will really ensure the greatest amount of success. The part that was interesting to me about the plan is that, or the proposal, was that the Plan B was the one that had the most energy put into to solutions, that had the greatest range of alternatives. Where I really think that distance learning or online learning is going to be way more impactful moving forward, and there really just didn't seem to be a lot of solutions to fix that.
That's the least palatable of all the solutions to everybody, I think.
For sure.
We want to get our kids back in classrooms.
Yes.
Chris, there are a lot of parents that are saying, we're going to sit and watch this. They are upset because they were not required, students and teachers and personnel were not required to wear face coverings, and they're saying we want to wait and see how we think this is going to be. What happens if a large number of parents just refuse to send their kids back to school?
Well, I think that could happen in some areas. I think that's why we have to be so careful and make sure that people understand the risks, understand what the plans are. I do think it's going to be some version of going back to school. I don't think anybody thinks it's going to be online only unless things get much worse, which I hope they don't between now and August. The hard part, of course, is there's not only children in a school, there are staff members. There are teachers who are over than 60 years old. There are people that have health maladies that make them more at risk. And I'm a little worried about how we staff a school safely during this pandemic. It's not something we can't overcome, but I think that's one of the primary risks. The people at risk here are the adults in the school.
Howard, let's look at this thing from a today perspective. If the governor had to make this decision today, I think he'd have a hard time adopting Plan A, which is the minimal kind of opening. And certainly nobody wants to go to Plan C, which is going back to online learning. The question here is, if we have to go to the Plan B, which includes perhaps children going to school half a day and staying home half a day, or going one day and staying home the other, this is going to put an incredible hardship on parents who have to work, isn't it?
It will. And of course, I find Plan B to be the most acceptable, but yet the most difficult to manage. But it has been done before. We have had pressures that have had us go to half-day schools with kids coming in the morning and then another group coming in the afternoon. So we could make it work, and certainly I think it would be the safest. But I'm also concerned about being able to transport kids, 10 and 20 kids on a bus, which I think is going to be extremely expensive.
Well, not only that, but the legislature this past week, John, passed a bill in which they robbed the fund for bus replacements and repairs in order to be able to help shore up budgets somewhere else. Is this going to be another bill that Governor Cooper is going to veto?
This is just the beginning. It is very clear that we will not be spending on capital the way people had anticipated. That includes school buildings, because we have billions of dollars in upcoming budget deficits. And even without replacing school buses, which is what that fund is for, as Howard says, Plan A, in fact, forget Plan B for a second, which I actually don't think will happen. Plan A would require some additional expense, perhaps a lot of additional expense.
And one of those additional expenses is teachers and nurses in every school. For schools that are already complaining about not having funding, and with us with a teacher shortage, Chris, this could be a very problematic. A number of our teachers are already, reaching some age, if I can say that as delicately as possible, and might not feel safe going back into the classroom this year. So this presents some real problems, doesn't it?
It does. That's what I was, getting at earlier, which is that the staffing and the sort of senior teachers, senior in age teachers and staff, I think will certainly have some concerns. It does remind us that a long time ago, we needed to spend more on school nurses and make sure they were there. It's especially important now during this pandemic.
Well, the July 4th period is going to be very exciting around here, because we've got a lot of judicial decisions. The governor's going to have to make decisions on schools, and we certainly are going to be talking about them as time goes on. The one thing I think everybody can agree about is that we really do want to get our kids back in school. And right now, we really do want to hit the panel to tell us something we don't know. Howard Lee, start us off. Tell us something we don't know.
When I look at things that are going on right now, to me, it's kind of like living a long, dreaded nightmare. July 19th is something called June 10th, and that's the day the slaves were freed. And it disturbs me that Tulsa, Oklahoma, certainly ended up being the massacre that we all grew up reading about. And for the president to go and hold a rally on that date in that community is simply going to open up a lot of old wounds. And I think it's going to spread in a way that won't be desirable.
Chris Fitzsimon, tell us something we don't know.
One of the most interesting issues, I think, is that the military playing a role in what's happening in our country in the move for racial justice. The chairman of the Joint Chiefs of Staff this week apologized for marching to the church with President Trump. The military leaders are open to renaming bases that are named after Confederate generals. A Republican committee this week voted to do that within 3 years. Senator Tillis objected, So he disagrees with, it looks like, the military and a Republican committee. That's going to be a big issue, I think, in the campaign.
Got about a minute 30 left. AB, tell us something we don't know.
So the millennial generation has been named the most unlucky generation in history. Yeah, it's a bummer. But 59% of millennials are actually withdrawing from their 401k retirement plans early.
Yeah.
And one of the main reasons is because of the financial restraint from COVID.
Would you know anyone in that generation?
I do. I know quite a few.
John, tell us something we don't know. We got about a minute.
All right. Well, North Carolina lost about a little over 50,000 jobs in March and April in the area of healthcare and social assistance. We don't know what the numbers are going to look like for May yet. We'll have those in another week or so. But it is likely that a lot of those jobs will return. A lot of dental practices, doctor practices have been adding back in. Daycares, which is another area that has lost some employment, will have some recovery. So that one, at least, I think will improve in May. We'll have to see about some of the other categories.
We'll have to look at those numbers. Well, you've heard our spin on the issues of the day. To stay informed all during the week, sign up for our free weekly email newsletter. Give your feedback and read my weekly column. Visit our website, ncspin.com, or catch NC Spin on Facebook. While there, be sure to subscribe to our newsletter. Until next week, pay attention, watch out for the spin.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.